Have you noticed gradual but concerning changes in an elderly relative recently? Many believe that passing in advanced age happens suddenly, but in reality, the human body often gives quiet warnings weeks or even months before reaching its final stage. The challenge is that most families miss these signals because they appear insignificant initially. Only in retrospect do they realize the indicators were present all along, when it's too late to prepare properly or create lasting memories. In this article, we'll explore several key indicators that frequently appear during the final year of an elderly person's life. Some might be changes you've observed but dismissed as normal aging, while others may seem minor, yet actually signal the body's gradual decline. Recognizing these signs early provides you the opportunity to offer better care, treasure meaningful interactions, and ensure your relative's final chapter contains comfort, dignity, and peace. Understanding what's occurring means you won't be caught unprepared. You'll be able to make the most of remaining time with those dear to you. Let's begin this important journey together. Unintended weight reduction, one of the earliest and most revealing indicators that someone may be approaching their final months, is unplanned weight reduction. Initially, it might appear subtle: clothing, becoming looser, a diminishing appetite, or needing to tighten a belt further. Many relatives dismiss this as a normal part of growing older, but involuntary weight loss rarely indicates something positive. This change often suggests the body is no longer efficiently absorbing nutrients, muscle mass is decreasing, and essential systems are slowing down. Although aging naturally leads to some muscle reduction, when it happens rapidly, deeper processes are at work. The body might be struggling to digest food properly, or the individual may no longer effectively process protein, resulting in muscle deterioration. This strength decrease doesn't simply make movement more challenging, it heightens fall risks, weakens immunity, and makes the person vulnerable to infections. Another reason for reduced weight in the final stage involves appetite changes. Many elderly individuals simply don't experience hunger sensations as they once did. Their taste perception fades, food becomes less enjoyable, and they begin skipping meals or consuming smaller portions. This isn't merely preference, it's a physiological change. The body, sensing it's beginning to wind down, stops signaling the brain to seek nourishment as frequently. The result? Decreased energy, reduced strength, and gradual overall health decline. Underlying medical conditions also play a role. Weight reduction commonly accompanies chronic ailments like serious illnesses, cardiac insufficiency, or renal problems, all of which can progress substantially before obvious symptoms appear. Even psychological conditions or cognitive decline can lead to reduced eating, creating a downward spiral where the body receives insufficient fuel to sustain itself. Some families attempt to address this by encouraging their relative to eat more, offering favorite dishes or supplementing meals with protein drinks. However, if weight continues dropping despite these efforts, it's important to recognize that the issue extends beyond diet. It's the body preparing for a deeper transition. At this stage, forcing large meals may not help. Instead, focusing on comfort, easily consumed foods, and hydration can make a greater difference in maintaining quality of life. If you observe significant weight loss in an elderly relative, especially if they're eating less, feeling weaker, or struggling to stay active, it's time to pay attention. This isn't just about physical appearance. It's about the body communicating a message. Understanding that message now can help you prepare for what's ahead with clarity, compassion, and the ability to make every remaining moment meaningful. Profound exhaustion and weakness. A notable change during the final year is deep, persistent tiredness that doesn't improve with rest. This isn't merely feeling slightly fatigued after daily activities, it's a profound exhaustion, making even simple tasks feel overwhelming. Rising from bed becomes challenging, crossing a room requires effort, and activities once routine, like preparing food, dressing, or maintaining conversation, begin feeling excessively draining. This extends beyond normal aging effects. It signals the body conserving remaining energy as organ function slows. The body begins prioritizing essential processes. The heart pumps less efficiently, circulation weakens, and muscles receive reduced oxygen compared to before. This explains why many elderly individuals in their final months feel unsteady, weak, and unable to maintain previous activity levels. Metabolic slowdown also contributes significantly. While the body normally produces and utilizes energy effectively, during its final phase, this energy gets redirected. Rather than fueling movement, the body shifts toward preservation. This explains why someone experiencing decline may sleep more, require extended daytime rest, and find staying alert for long periods increasingly difficult. Some experience sudden energy drops, seeming fine momentarily before becoming completely exhausted. Perhaps most heartbreaking is the emotional impact of this fatigue. Seniors who previously valued their independence begin feeling frustrated or embarrassed about inability to perform familiar tasks. They might withdraw from conversations, avoid social situations, or abandon hobbies, not from disinterest but from energy depletion. This can trigger isolation where they stop trying altogether, accelerating their decline. For families observing a loved one transition from engaged and active to withdrawn and exhausted, the experience proves painful. It's tempting to assume they're unmotivated or should push through it, but forcing activity won't help. What matters most is understanding their limitations, allowing necessary rest, and making their remaining time as comfortable as possible. When you notice a relative experiencing ongoing deep fatigue unrelieved by rest, recognize this as their body undergoing major transition. This becomes the time to cherish conversations, create peaceful moments, and support them without expectations. Ultimately, what matters isn't how much they accomplish, but that they feel understood, loved, and at ease. Mental changes and social. Withdrawal, as someone approaches life's final chapter, striking changes often appear in their thinking, communication, and interactions. You might notice previously sharp, engaged individuals forgetting things more frequently, struggling with conversations, or seeming disoriented in familiar surroundings. They might repeat themselves, forget names, or lose track of time, even without previous memory issues. These subtle cognitive alterations can appear months before passing. This surpasses everyday forgetfulness. The brain, like other organs, requires steady oxygen and nutrient flow to function properly. As circulation weakens and brain oxygen decreases, cognitive function declines. The person becomes easily confused, struggles with decisions, or has difficulty recognizing long familiar people and places. Some experience brief mental clarity followed by sudden confusion episodes, as if their mind alternately fades and returns. Emotional withdrawal represents another common sign. Those nearing life's end often lose interest in social engagement. You might notice them speaking less, engaging minimally, or spending extended periods sitting silently. This doesn't mean they've stopped caring about relatives. Rather, their brain processes emotions and interaction differently. Conversations become taxing. Loud environments feel overwhelming, and eventually, many seniors retreat inward. Mood and behavior changes may emerge too. Some individuals become irritable, anxious, or easily frustrated, while others seem unusually detached or indifferent to previously important matters. This isn't merely personality change. It's often the brain adjusting to bodily decline. As cognitive function slows, emotions become harder to express, and reactions to situations change. For family members, this stage proves especially difficult. Watching someone lose touch with reality or withdraw emotionally feels like losing them prematurely. Remember, they cannot control these changes. Instead of attempting to draw them back into conversations, meet them where they are. Speak gently, offer reassurance, and understand that even without response, they sense your presence. If a relative becomes increasingly forgetful, confused, or disengaged, don't ignore these signs. They often indicate mind and body preparing for final transition. Practice patience, treasure quiet moments, and create an environment feeling safe and peaceful. Even when words fade, comfort and love remain perceivable. Recurrent infections and delayed healing. As the body begins winding down, weakened immunity becomes one of the clearest physical signs. Someone who rarely became ill before might now catch every infection circulating. Previously, minor illnesses take significantly longer to overcome, and simple wounds like small cuts heal noticeably slower. These changes aren't coincidental. They signal the body's diminished ability to defend and repair itself. Repeated infections cause particular concern. Respiratory illnesses, bladder infections, skin problems, and oral infections become more frequent as immunity weakens. Many families assume these represent isolated occurrences, but when they happen regularly or resolve slowly, it often indicates declining ability to fight illness. Even antibiotics that previously worked quickly may seem less effective. The person might require stronger medications, longer recovery periods, or multiple treatment rounds for previously minor infections. This occurs because declining circulation and organ function reduce treatment response. Chronic wounds present another overlooked issue. When small scratches, sores, or bruises heal improperly or repeatedly reopen, circulation might be compromised. Poor blood flow means oxygen and nutrients don't efficiently reach skin and tissues, significantly slowing healing. Pressure sores, especially for less mobile individuals, present serious risks and can lead to dangerous infections without careful management. More concerning still, infections during the final year often manifest differently than expected. Rather than developing fever, an elderly person might simply appear unusually tired, confused, or disinterested in eating. In fact, sudden mental alertness decline often warns of infection even before other symptoms emerge. Recognizing these changes early impacts comfort level during life's final stage. For families watching someone experience repeated infections, frustration and heartbreak often follow. The temptation exists to pursue aggressive treatments, hoping another antibiotic course or hospital stay will resolve problems. However, at certain points, focus shifts from curing to comforting. Ensuring hydration, maintaining clean, moisturized skin, and minimizing physical stress often contributes more to well-being than additional medication prolonging discomfort. Respiratory and circulatory changes among the most telling indicators of the body preparing for its final stage are noticeable breathing and circulation changes. You might observe your relative breathing more slowly or shallowly than previously. Sometimes they pause between breaths or their breathing becomes irregular, accelerating, then unexpectedly slowing. Some develop gentle rhythmic patterns where breathing alternates between deep, rapid breaths and extended pauses. These changes may begin subtly, but progressively become more pronounced and frequent. Weakened circulation represents another common sign. You might notice extremities, hands, feet, nose, and ears, feeling cold when touched. Skin may appear pale, bluish, or mottled, particularly around fingers and toes. This happens because the body prioritizes blood flow to vital organs, reducing circulation to extremities, clearly indicating the heart isn't pumping as strongly as before. Some also experience increasing breathlessness even with minimal movement. Simply sitting upright, speaking, or changing position might leave them winded. You might notice increased mouth breathing or sudden pauses to catch breath during conversation. Someone previously able to cross rooms easily but now struggling suggests declining lung function. In some cases, fluid accumulation makes breathing difficult, causing persistent cough, gurgling sounds, or chest tightness. Many assume this represents cold-related congestion, but for elderly individuals nearing life's end, it often signals weakening lungs. This can make lying flat uncomfortable, leading them to prefer sleeping propped up or in recliners to ease breathing. For family members, witnessing these changes proves frightening. Natural impulses emerge to help, encouraging deeper breaths, or worrying something urgent is occurring. However, usually this simply represents the body's natural slowing. While these changes may not be reversible, comfort measures exist. Maintaining cool rooms, using humidifiers, or offering small water sips can ease discomfort. Sometimes medications or oxygen therapy provide relief, but focus shifts toward comfort rather than fixing the issue. If you notice these signs, changed breathing patterns, cold extremities, or bluish skin tint, pay attention. These typically indicate energy conservation and slowing circulation. This becomes a time for presence, reassurance, and creating peaceful environments where they feel secure. During these final months or weeks, the greatest gift isn't medical intervention, but comfort, dignity, and companionship. Final reflections, as we conclude, reflect on the significant signs we've discussed: unintended weight reduction, profound exhaustion, cognitive changes, recurrent infections, and major breathing and circulation alterations. These indicators often emerge during an elderly person's final year. They rarely appear simultaneously or obviously initially, but noticing them signals the body preparing for its final transition. For many families, accepting these changes proves challenging. Natural instincts emerge to resist, encouraging relatives to eat more, move more, or overcome exhaustion. However, sometimes the wisest approach involves listening to what their body communicates. Rather than focusing on reversing inevitable processes, we can prioritize making their remaining time peaceful, comfortable, and meaningful. Understanding these signs isn't about fearing death, but preparing appropriately. Early recognition allows better care, timely decision-making, and ensuring your relatives' final months contain love and dignity. This becomes a period for cherishing moments, sharing stories, and conveying that they remain valued and accompanied. If you're noticing these indicators in someone close, take a deep breath and remember you're not facing this journey alone. Many families have walked this path before, and while never easy, understanding expectations helps discover strength, patience, and peace during this profound transition.